Blood sugar, also called glucose, is the main nutrient that every cell in the body uses for fuel. The important concept, though, is that insulin is required for the cells to take sugar out of the blood. So if there is either not enough insulin or the insulin that the body makes is not effective to tell the cells to take the sugar out of the blood, glucose stays in the blood and the blood sugar rises. And when it rises to a certain point, that becomes diabetes. So there are two main types of diabetes. The first type is called type 1 diabetes. This is seen in about 5 or 10% of patients with diagnosed diabetes. This type of diabetes used to be called other things such as childhood onset or juvenile onset diabetes. Other terms used to be insulin-dependent diabetes. Those are terms we don't use anymore. The current term is type 1 diabetes. This form of diabetes, the body has essentially no insulin production. So you have no insulin. So by definition, you essentially need insulin from the very beginning of the diagnosis. It does often affect children first. They're diagnosed in young childhood. However, I've diagnosed patients in their 50s with type 1 diabetes, so really age is not a criteria. Type 2 diabetes is the most common type and is the main focus of tonight's talk. That makes up the bulk of patients with diabetes, about 90% or more. This used to be called adult onset or non-insulin dependent diabetes. These terms, again, are not very appropriate because unfortunately, with the obesity epidemic, I've diagnosed children, teenagers with type 2 diabetes, and many patients with type 2 diabetes ultimately do require insulin, so non-insulin dependent is not appropriate either as a term. So risk factors, there are a lot of different risk factors. These are the most commonly accepted ones. Prediabetes, I just mentioned, patients with prediabetes are more likely to develop diabetes in their future. Patients over the age of 45. People that have a family history of diabetes and a parent or a sibling have a higher risk of developing diabetes themselves. Patients who are overweight, people who don't exercise on a regular basis. People have a low good cholesterol. HDL is also called good cholesterol. So having a low good cholesterol or high triglycerides or high blood pressure also increases your risk of developing diabetes. Certain racial and ethnic groups, African Americans, Hispanics, American Indians, these all have a higher rate. Women who have had gestational diabetes or who have had a baby weighing more than 9 pounds at birth. Gestational diabetes is diabetes that's seen in pregnancy. These women have a 50% likelihood of developing diabetes in her lifetime. So it should be noted. The reason why it's important, of course, to diagnose diabetes is that we can treat diabetes and we can prevent the complications that we see in patients with type 2 diabetes. The complications can be separated into two main categories. The first category is called microvascular or small blood vessels. We see these in the eyes, in the kidneys and the nerves, especially the nerves down to the feet. And this is separate from the large or macrovascular complications. And this is where we see large blood vessels leading up to the brain, blood vessels in the heart, and blood vessels going down to the legs. So there's two main categories of complications that we can either prevent or reduce by treating. A couple of statistics. It's important to note that 2 out of 3 patients with diabetes ultimately die from heart disease or stroke. So that is really the main focus, or at least should be the main focus when we manage diabetes, not just focusing on blood sugar, but focusing on the overall risk of heart disease and stroke. Diabetes is still the #1 cause of adult blindness and kidney failure. Fortunately, although this sounds like a lot, this doesn't happen often because of our techniques at controlling blood sugar. And diabetes causes more than 60% of lower extremity amputations that are not due to trauma. So preventing complications. Tight blood sugar control is very important at reducing the damage seen in the small blood vessels. As I mentioned, the eyes, the kidneys, and the nerves down to the feet. But no good study has shown that controlling blood sugar reduces the risk of heart disease and stroke, which is, as I mentioned, the biggest concern that we ultimately have. So that's where you end up focusing on blood pressure, which reduces the risk of both small blood vessel and large blood vessel complications. And cholesterol control should be very important in management of type 2 diabetes. Instituting good preventive care practices for eyes, Kidneys, feet, teeth, and gums are also very important.